machine. They have to go through a fiber about 2 meters long. You lose energy. Okay? Some companies tell you, oh, we have 7 watts maximum output. But is it 7 watts at the laser gun in the machine, or 7 watts at terminal? We don't know. They don't tell you. With this, there's less loss of energy. And it's pretty easy to operate. It's small, pretty straight. You'll see that in there. The other really good one is a cable Key 3 laser. Okay. This, the really big special part is it has a feedback system. It automatically detects calculus and carries. Okay, so you can remove them without damaging extra tissues. Even if you step on it all the time, nothing happens. If you remove everything that you're supposed to remove, it's done. Okay, electron. This is actually the first version. Second version is a little different now. At the time when it came out, it was fairly new to the market, so it didn't have as much clinical research as other people. Whatever they use, they actually use a lot of very general arrhythmia. It's not from electron laser system. But now, we're at the 7th year of the company. They have a lot more paper. It's pretty complete. Good system. But you see, they combine 2 systems in one machine. On the left is everything. On the right is diode. Okay. It's a more complete way for a clinic, because it's, as a dentist, when you go into a laser, when you start thinking about buying a laser, you have to think what you want to do with the laser first. Then you buy the right one for you. What other people have might not be what you want, because they might do different things than you do. Okay? Do you want to work on hard tissue or not with a laser? If not, don't buy everything. Buy a diode. It's enough for you, because the price are huge difference. That one is over 1 million Hong Kong dollars. That one is about 500 something thousand. Okay. But a diode laser is 10,000. About 50,000. So huge difference in price. You really have to think what you want to do with the laser. Then we get into water lasers. This is the old version, the first version. Now this is MD, the latest version. We've already talked about it's a less efficient wavelength. So, and they created a lot of marketing hoax. Okay. There's one term they use, it's called hydrokinetic. Okay. It means the cooling water, the spray, the water spray, is they say it's a cutting water spray. You can cut with water your face. How is that possible? That's not possible in the mouth. Yes, there are water blades in industrial world, but not in the mouth. It still cuts by laser. This is a marketing hoax. Okay? They tell you lies for you to buy laser. It works. It still works. It still works as a hard tissue laser, but less efficient, and they tell you a lot of lies. You really have to use it for a while to find out the full capability. There are a lot of lawsuits around the world on water lasers for false advertising and false promise from the sales rep to the dentist. So here's the research paper basically telling you water lasers is 55% less efficient than irradiation. So that's all about Armagnac. Let's go into diode real quick. Clinical cases. Here's a hemogeo, basically a tube, blood tube. This is what patient had a long time ago. This is reoccurring from a different location. The first treatment was done conventionally, so you leave a pretty nasty scar right on the face. And the patient decided to use laser. So we use topical anesthetic, and we're ready to go. Use a laser, dial laser, and start cutting the area into the lip. And then, of course, dial laser always have hemostatic effects. And you leave a little bit of scar behind. So it covers the surface. Then you don't have to put any medicine or any bandage over it. This is what happens in 6 days. Okay? There's no swelling. It's healing nicely. 20 days. Can't even tell whatever happened there. But you can always tell something happened there in the upper lip. Using laser, is it really that much better for a dentist? Sometimes it's not. Laser is better for the patient. The healing process is faster, it's more comfortable, and less scarring. It's for your patient. And for you, maybe you don't feel much difference compared to conventional treatment. There's a fibroma on the tip of the lip, or tongue. So the 3 watts continuous wave, you get one of those. Okay. So you don't have to do anything to the wound. 2 days later, 7 days later. Back to normal. This is hyperplasia. Right after the surgery, it looked like that. It looks kind of messy. But how do you treat these conventionally? How do you treat hyperplasia conventionally? You take a bird? No, it doesn't work. There's nothing you can do. You just tell the patient to go and brush better. You really need to pay attention to this area because there's overgrowth of gum. It's easier to get period disease, so take care of it. That's pretty much all you can do. But with laser, you can actually trim it down. 1 week later, pretty normal looking. Here's a Here's a tumor or anomaly on the lip, salivary gland. So basically cut it off. And cut out a good portion for second analysis. 14 days later. Another fibroma. 5 days later, okay. With period disease, or worse, dial laser works in the sense of decontamination, killing the bacteria. It doesn't remove any turbulence. You still have to do removal the conventional way. Okay. Now, back to theory. Why can't we really have good control of period disease? Mostly it's because we can't kill the bacteria very well. Okay? We can use local, some tablets that you put in. We can use systematic antibacterial, and then we can do irrigation, but you know the results. You know it's only effective probably 50%. That's it. So, with laser, you can really go in, localize, killing bacteria. Okay. How does a dial laser kill bacteria? It's by heating to a point where it shrinks and dies. That's it. Nothing big to it. Urban yak works differently. Where urban yak will give the energy to the water inside of the bacteria, and it explodes. Okay. They both kill bacteria, but in different manner. They both cut soft tissue in different manner. So you have to think about what you want to do with the patient. Then you decide what you want, which laser system you want. this is